10 women in your life, at least one of them is likely to have endometriosis. However, many women are unaware that their symptoms of severe pelvic pain and irregular and heavy menstrual bleeding might be caused by this gynecological condition. With the guidance of patients, researchers, and clinical experts, the Society for Women's Health Research has designed a toolkit to assist individuals with endometriosis in navigating their care. Our Endometriosis Toolkit is a patient empowerment guide that provides easy-to-understand information and resources on menstrual health and stigma, understanding endometriosis, diagnosing and treating endometriosis, navigating endometriosis through the teenage years, pregnancy, and menopause, and managing a healthy lifestyle with endometriosis. Let's begin with menstrual health. Puberty marks a time when a woman begins to experience a monthly discharge of blood and uterine lining, known as a period. Every day, more than 800 million people are menstruating worldwide. A typical period occurs every 21 to 35 days and lasts for 2 to 7 days. Bleeding should average no more than one soaked feminine pad or tampon every 3 hours. It is common to experience symptoms like cramps, bloating, and changes in sleep, appetite, and mood. It's important to note that a normal period is not the same for every person. What's normal for you might be different than for your friends or family members. However, it is not normal when your period-related symptoms cannot be managed with over-the-counter medications or when they significantly disrupt your life. Period symptoms can cause discomfort, but they should not be distressing. Tracking your menstrual cycle is a good way to figure out what is normal for you. It can also give your healthcare provider a more complete picture of your symptoms, their severity, and their impact on your daily life. You can use a calendar, notebook, or a health app to record information like, my period started on Monday, May 10th and ended on Friday, May 14th. And day 2 was my heaviest flow day. I used 7 pads. You should also note both regular and unusual symptoms, such as consistent pain in your lower back, where you experience pelvic pain, and if it shifts location, headaches or trouble sleeping during your period, constipation or diarrhea, and if your monthly cycle was off by a few days. By recording your period experience each month, over time you can look back and see what normal and abnormal looks like for you. If you choose to use a health app, the Federal Trade Commission provides guidance you can read online about how to select and use health apps while reducing privacy risks. Aunt Flo, time of the month, Shark Week. We have many code names to refer to our periods. Societal and cultural stigma around menstruation can prevent women from voicing their concerns about life-disrupting, period-related symptoms, even to their healthcare providers. When stigma silences women, they are more likely to experience delays in diagnosis and treatment for gynecological disorders like endometriosis. Studies say that for some, it can take up to 6.5 years before they are properly diagnosed with endometriosis. 20% of women are uncomfortable discussing menstrual health with their doctors, and 10% of men are uncomfortable talking about it at all. Dismissing severe symptoms and pain as an expected part of the menstrual cycle can play significant roles in perpetuating period stigma. How can you help fight this stigma? Don't be afraid to talk openly about periods with friends, family, and others. Refrain from using slang terms and code words for menstruation. Call it what it is. Don't feel like you have to hide your menstrual products. And advocate for better menstrual health education in schools. For more information about endometriosis, or to download a copy of SWHR's Endometriosis Toolkit, a patient empowerment guide, visit our website, www.swhr.org. We also invite you to follow us on social media or sign up for a newsletter to get the latest in science, education, and policy concerning important women's health topics. The Society for Women's Health Research would like to thank everyone who contributed to the development of this toolkit, especially our Endometriosis Network, House Cat Creative Publishing, LLC, and programmatic sponsor, AbbVie.